I think just like every difficult topic and every uncomfortable situation, a lot of it has to do just with a simple lack of knowledge. The clinician doesn't feel equipped to approach the topic, approach the patient, and they certainly don't know what to do once they identify somebody. Kind of like the dog that finally catches the car. What do I do now? So I think part of reducing the anxiety behind it really has to do with education. And so when you look at education surrounding this topic across all types of fire and EMS services, and EMS in particular, whether it's hospital-based, third service, private, the education is all over the place, and sometimes it's non-existent. And so the first thing is to get the topic introduced by educators, not only after they're hired onto a service to be an EMT or paramedic, but honestly, it needs to be introduced into the schools where part of their training to become an EMT, the training to become a paramedic has to include this topic. Because again, we're in a very unique situation to identify these victims because the vast majority of them, again, at some point in time, will in fact encounter the emergency medical system, whether pre-hospital or in hospital in the emergency department. So we have to be able to talk about it and at least recognize it, and then give the clinicians tools to use when they find themselves unexpectedly in front of someone who is most likely a victim of human trafficking. And I have found that even giving them questions to ask, how to ask the questions, awareness that the patient may not even realize that they're victims of trafficking, which is a huge eye-opening moment when we get to that in classrooms. I think that helps a great deal to reduce the anxiety, because especially when you tell the EMS clinicians, hey, we're not expecting you to then tackle the perpetrator and rescue this victim right away. We just want you to recognize it and approach it and report it to the receiving hospitals. And that's why it's really important if a EMT or paramedic has the choice to transport to a place where they know has really good social work services and case managers versus a place that doesn't. That by itself is an important distinction. Go to the facility that has good social workers who are knowledgeable and who have resources to get law enforcement involved. And that goes a long way in rescuing this person.